All right, hi, I'm Brianna. I'm going to be your nurse today. I just wanted to take a moment to explain the tests and procedures that your doctor do have in for you to have done. Okay, so the first one is the bronchoscopy, the barium enema, and the liver biopsy. Okay, so during this one, it's a test that lets the doctor look into your lungs and airways. During the procedure, a thin, soft, flexible tube with a small light and camera is inserted into your nose or your mouth, down your throat, into your lungs to give the doctor a better view into your lungs. During this procedure, your vitals will be monitored and most likely will be given sedation, medication. And this procedure is about 30 to 45 minutes long. Okay, so this is what it looks like when you're having this procedure done. And it allows the doctor to view the airways to check for any abnormalities or anything that could possibly be wrong or going on inside of your lungs or your airways, your bronchioles, the lobes. Okay, the reason you might need done is to find out if you have any lung issues or any lung problems. You might get one done if you have any symptoms of a cough that hasn't gone away, if you're coughing up any blood, trouble breathing, an infection, if there's an abnormal chest x-ray, to get biopsy lung tissue to remove blockage or to even put in a stent lungs. Okay, so those are the reasons you might need one. Okay, so to prep for this, you will most likely be NPO, and the doctor will have you stop taking certain medications such as aspirin or any type of blood thinners. They will have you take your glasses off and hearing aids out, no dentures, no partials. And if you are leaving after the procedure, it will be good for you to plan ahead to see if you can have someone drive you home because of the sedative medicine that you might receive. If staying at the hospital, the nurse will definitely monitor your vitals during this process before and after. Okay, so after the procedure, the anesthesia or sedative medicine should wear off. Once again, your vitals will be monitored and you won't be allowed to eat until your gag reflex returns. Okay, you might have some chest pain and maybe even coughing up a little bit of blood after this procedure, and soreness and hoarseness. Okay. All right, so with a barium enema, this is basically an x-ray that can help the doctor detect changes or any abnormal things, any abnormal findings in the large intestine, which is the colon. It's also called a colon x-ray. So this is an enema with barium that is injected into the rectum through a small tube. The barium coats the lining of the colon, okay? And the coating results in a clear image of the colon for the doctor to see if there's any issues going on. Okay, so air is pumped into the colon to expand and to improve the quality of the images of the colon. During this procedure, your doctor will have you lay on your side as a lubricated enema is inserted into the rectum and the barium is delivered into your colon. Okay, so there might be some abdominal cramping that may occur. Okay, so here's a visual. And that is how you will lay in left Sims. Okay. And that is how they would inject the barium into your colon there. That's the colon. Okay, and this is the enema. The tube that's injected to inject the barium liquid. And this is what the colon x-ray will look like. And that is the barium that helps the doctor see. Okay, so you might need this barium enema done, also known as a colon x-ray, to investigate the cause of abnormal or any abdominal symptoms, any abdominal pain, any rectal bleeding, changes in your bowels, or unexplained weight loss, or chronic diarrhea, or even constipation. Okay. So to prep for a barium enema, the doctor will instruct the colon to be completely emptied, which could be emptied by laxatives and enemas. You will also be instructed to be NPO, which is not having anything by mouth, so no drinking any liquids or eating any foods, solid foods or anything. And you may be instructed to stop taking certain medications. Okay, so after the procedure, there will be additional barium and air that will need to expel from the rectum. You might have some pasted white stool from the barium coating your colon, abdominal cramps, and you will eventually be able to return to your regular diet. Okay, so during a liver biopsy, this is a procedure with a small needle that is inserted into the liver to collect a tissue sample of the liver. The tissue is then analyzed in the lab to help doctors diagnose a variety of different disorders and diseases that could possibly be in the liver. Okay, so here is a visual of a liver biopsy. And that is a biopsy needle. Okay, and the doctor will locate your liver first. Okay, and then insert it to remove some liver tissue to put in a dish so it can be examined under a microscope to see if there's any diseases or issues going on in the liver. Okay. Why you might need one done, once again, if there's any issues or any symptoms or signs that there may be some issues. Okay, so it helps identify why there's any cramping or yellowing of the skin, if there's persistent abnormal liver blood tests, or any weird findings found on an ultrasound or a CAT scan, or enlargement, to see if there's an enlargement of the liver. Okay, so to prep for a liver biopsy, if pregnant or have lung conditions or allergic to any medications, let doctors know, and stop taking any blood thinners and medications or any inflammatory drugs. You would need to probably wear a gown, no dentures, no glasses, no hearing aids, once again. And get your vitals taken by your nurse. Okay. And then after the procedure, you will stay in recovery for a few hours afterwards and have your vitals monitored. You will have pain and still avoid taking blood thinners after a procedure like this. You don't want to bleed out or anything. And you will be instructed to not do any heavy lifting or any harsh physical activity. Okay. All right, so those are the 3 procedures that I wanted to describe and to explain to you. Once again, here's a visual. Okay. And another visual for the enema. Insert into the rectum, into the large colon, the large intestine, also known as the colon. Hopes images be clear. Okay, that's the barium enema. and a liver biopsy, which is when liver tissue is removed with a biopsy needle to be viewed under a microscope. All right, so those are the 3 procedures. If you have any questions, let me know.